If your therapy soap notes take too long or never sound clinical enough, this video is for you. Today, I want to show you how to write soap notes for therapy in a way that is faster, clearer, and more compliant without turning every note into a huge writing task. SOAP stands for Subjective, Objective, Assessment, and Plan. And the biggest mistake therapists make is trying to write everything that happened in session. You do not need a transcript. You need a clear clinical summary. Here's the simple way to think about it. Subjective is what the client reports. This includes symptoms, stressors, emotions, and concerns in the client's own experience. For example, client reported increased anxiety this week related to work stress and difficulty falling asleep most nights. Objective is what you observe. In therapy, that usually means presentation, behaviour, affect, speech, engagement, and anything clearly observable in session. For example, client appeared tense, spoke rapidly, and was engaged throughout the session. Assessment is your clinical interpretation. This is where you explain what the session suggests clinically. Is the client improving? Are symptoms interfering with functioning? Is insight growing? For example, client continues to experience moderate anxiety that is affecting sleep and daily functioning. Insight remains good. Plan is what happens next. This is where you document the next treatment step. For example, continue weekly therapy. Client will practice grounding skills daily and track anxiety triggers before next session. That's the structure. Now here are 3 quick tips to make your soap notes better. First, keep the subjective section focused. Only include clinically relevant details, not every story from the session. Second, make the objective section truly objective. Avoid vague phrases like client had a hard time. Describe what you actually saw or heard. Third, do not repeat yourself. A lot of therapists say the same thing in subjective and assessment. The assessment should add your clinical judgment, not just reword the client's report. So if you want faster, better therapy soap notes, remember this. Subjective is what the client says. Objective is what you observe. Assessment is your clinical interpretation. Plan is the next step. Use that framework, keep it concise, and write what matters clinically. In the next video, I'll break down how to write DAP notes for therapy and when DAP notes may actually be faster than SOAP notes.